Okay, so welcome everyone to our inaugural symposium for machine learning and implementation and evaluation. SMILE was the acronym. We have a really great program for you today. And to sort of open this all up, there is a Slido. So later on, we'll show some of the results from this. But please, if you've just logged in, log in. We'll be reminding people as they come in. And during one of the break sessions, we'll see a little bit about who the different people are that are here. So we just wanted to start with a few words from Nader, our CIO. Nader, you want to take it away a little bit and tell us a little bit about, predictive analytics and how you see AI and ML in your eyes.
Thank you, Ian, and good morning, good afternoon, good evening, since we have colleagues from all over the world, and so I'm sure it's different time zone in different places. I'm delighted to be here. We see AI and NLP as a very strategic capability. We have been investing in this space because we think that will improve care and outcome, given that so much data is thrown at our clinicians to decipher, and these type of technologies is really essential how you could treat with good insight patients. And also we deploying that in medical research and medical education as well. So it's an essential capability. We also don't want to minimize the application of AI and machine learning in the area of the administrative aspects of healthcare, which is highly regulated, a lot of requirements, and to the extent that we could deploy AI and process automation to reduce that burden of administrative aspects of healthcare, we find value, and we continue to do so. So we think this is a strategic technology capability in the space of a healthcare provider space, and it's great that with this symposium, colleagues are getting together, sharing ideas, learning from each other, and have great presenters here. And hopefully it'll be a great afternoon for us and to all our colleagues around the world who care to join in. Thank you.
Great. Thanks, Nader, for those few words. Yeah, so let's just get started with a little bit of a broader introduction to the conference today. So my disclosures, I'd have a little work that I do with Pfizer. I'm supported by CTSI and an NSF grant, the Future of Work grant. So welcome. Four of us have come together to organize this conference today for you, and just really excited to bring people together. We had almost 600 people register, so it really makes us feel like we're touching on a nerve of somewhere where in the implementation and deployment of AI and ML, there's a lot of opportunity. So, welcome from myself, from Vikas Chowdhury at PCCI, Narjis Razavian, who is a professor in population health, and also Karen Deep Singh, who's an assistant professor at the University of Michigan. So we're here because of really this bottom right-hand corner here, where we just really noticed, early in my career, that there were a lot of people that were writing about AI and ML, but there was very little that was actually implemented into clinical practice, both on the operational and the clinical side. And so about 6 years ago, myself, Nader, and some of the leadership here were thinking about, well, what are we going to do next, and what's going to happen? And based on this, we kind of pitched this vision about AI and ML being a strategic objective and a first-class citizen, and really enabling AI and ML. Let's see. So let me next slide, please. Am I owning the slides? Yeah, so what's the purpose of the predictive? So I run a predictive analytics unit here at NYU, whose objective is to try to realize the value of AI in healthcare. We have a couple of things that we do. Next click. We provide capacity for predictive modeling and increase operational efficiency, drive value, and translate AI models to point of care. We lead specific projects from inception to development, deployment, and evaluation. We have a master's PhD program, clinical fellowship as well. And finally, we're an umbrella organization for collaborations with places like Facebook, Microsoft, and other folks. Next slide. So in a nutshell, there are 4 things that we do. So we do implementation. Oops, sorry. And so when we think about AI and ML, what does our group do? If you come from the academic side, you might think a lot about ML code as being, the most important thing. But the actual reality is, if you look at this, there's actually, ML code is actually a very small piece of this. So next click. And you can see that there's a lot of infrastructure around getting these models out there and making them successful. And this is just on the technical side. Next slide. So in a nutshell, what we do is implementation, deployment, integration, and finally evaluation. And that's really what this conference is about for us today. Next slide. So what's some of the exemplary work? COVID-19 was a huge, huge sort of surprise play on a lot of on the country, and NYU was a starting point of that. And so, we consider ourselves a very agile organization. And so, just as an example, we built a model in our first model in about 3 days. Took us about 3 weeks to refine this model, and we got it integrated into the EHR in about 6 weeks, and went into clinical trial in the 10th week. And then finally, we ended up posting this to Epic App Orchard for others to install about 8 months after the clinical trial started. And so, this timeline was a little bit longer than it would take to do it now. We worked out we were doing things that people hadn't done before. So it took us a little while to figure things out, and this timeline will be much quicker. But this is what we mean by agile data science, about providing value, right, very quickly and very seamlessly. Next slide. So what do we hope to accomplish today? Well, this is really a mix of stories representing different kinds of hospital systems, the communities that we serve, pediatrics versus adults, and different EHR vendors. It's a taste of many organizations' stories and journeys. It should feel very informal and friendly, and I hope that that's the feeling that we get out of this. And it's what I call the anti-journal content. And what I mean by that is, a lot of times when you publish in a journal, next click, they really focus on results. And this is not a focus of this conference. It's not about models or results of an outcome. It's really about the stories of getting there. Next click. And it's a focus on stories of implementation, deployment, integration, and evaluations. Funky engineering stories. So we have one engineering story where we built a model to predict risk of diabetic outcomes in the future. And we were using identified data because it was for an operational objective. And we found that it was learning actually on a person's name, and that's what the model was learning. And these are funky engineering stories that have strong implications for what we for generalizability to other places. But these aren't the kinds of stories, right, that necessarily get written up and talked about. Next click. About your failures and challenges, right? What did you run up against, and how did you overcome them? And finally, you're not alone. This is about building a community, bringing us all together to have these conversations together and try to make AI, to realize the value of AI in healthcare through this community and through learning together. So what are the rules of engagement for today? A couple things. Let's see, I think you should be able to rename yourself. And I haven't done that yet, but I will. And we wanted to just, rename yourself as your organization, your role, your name, and then some contact information. Sometimes, and with these webinars, people can just look like a whole host of names, and we, want it to be about each individual. Next slide, or next click. We have chat turned on. So these are comments and questions for all. And we're hoping that the chat may be more valuable than the talks. We thought the interaction through the comments was more important than the risk of spam. So, we apologize beforehand if spam shows up. We apologize. We have a security team here on the other side, which are our co-hosts, that will deal with them if there are spam-like comments. If you want to find collaborators or models to share, make an announcement or share a story, post them in chat and we'll collate and put them in a post-meeting summary for everyone. There's an opt-out listserv that we're putting together based on these registrations, and we're going to send a post-meeting notes and announcements to the listserv. And think of this as the beginning of a community conversation that we can have together. And I'm hoping that we can figure out ways to tell some of your stories after this conference is over. And the Twitter hashtag is SMILE4H if you decide to tweet about it, and nyumc.org/smile4health if you want to link to the summary of today's day. Next slide. So thank you. The true organizers are some of my colleagues here, Tamara, Ben, and Crystal. They were intimately involved with making this happen. We would not have been able to do it without them. I want to thank our leadership team and bringing us together, the Epic Data Science team, and helping to enable a lot of the things that we do and get those into production. The many clinical leaders of all our various projects that we have, and also my team as well.